Hi, my name is Dr. Judith Hellman. I'm a dermatologist and I will talk today about new and interesting treatments for acne and acne scarring. Just a little bit about myself. I'm board certified. I work in New York City. I do practice medical dermatology, but I have been treating patients with lasers and also other anti-aging modalities for many years now. Um, I'm a voluntary attending on the staff at Mount Sinai Hospital in New York City, and I teach residents there. My practice experience with acne goes back many years when Accutane, at least in the US, became very tightly regulated, and people became also much more aware of the potential side effects. And I'm not a big fan of oral antibiotics, which are only good as long as patients take them. And therefore, when patients stop taking them, the effect wears off. And so I don't see it as a good long-term strategy. And I don't think people from their 20s into their 40s are going to be able and should take antibiotics day after day. During my experience with lasers, I started experimenting with the pulse dye laser, which targets very selectively the red color. Red color represents inflammation, acne, and acne pimples and papules and cysts are all red. So basically, the pulse dye laser targets the inflammation, the blood vessels that mediate it in the skin. The treatments were very successful. I still do use the pulse dye laser, but the pulse dye laser doesn't really help anything at all with acne scarring. So for acne scarring, I had to incorporate second lasers, such as the F-Firm multiplex, which is a non-ablative resurfacing modality, and or the erbium YAG, which is an outright resurfacing. But the patients had to do two lasers, not one. They had to pay for two different treatments, not one. And so I still didn't think that this was the ideal solution. Let me talk a little bit about what acne uh, is caused by. First of all, people are genetically sometimes predisposed. Very often, if somebody has bad acne, you can find someone in their family, mother, father, who had acne when they were younger. So it can be inherited. But all acne pretty much is hormonal in its basic causality. The female and male hormones, if they get out of balance in females, can cause increased production of sebum. And so when more sebum is produced, it gets plugged up in the pores. It cannot get out. And bacteria that live in the skin called P. acnes can multiply in those plugged pores and start causing inflammation. So basically, acne is an inflammatory condition that is genetically and or hormonally induced, but ends up as inflamed red pimples and later on scars in the skin. This slide just basically talks a little bit about the stages of acne. So you can see a normal sebaceous gland that can develop into a blackhead or open comedone with an open area on top of the skin. But if that area is instead of open becomes plugged, like in a whitehead, now we have a closed comedone that keeps accumulating the oil that's produced in the skin. And at some point, it gets irritated by the bacteria and it becomes a little pustule. And those pustules can later on turn into and develop into big nodules and cysts. And of course, cysts can develop later scarring. So the types of acne that we are looking at, you can have comedonal acne that can be blackheads or whiteheads. You can have papular acne or pustular acne, which are just smaller or larger pimples and pustules. And of course, at some point, this can progress to cystic acne with or without acne scars. And I just want to mention here that rosacea, even though it's a little bit different in causality, is very similar in appearance. It's red, it has a lot of inflammation, it has a lot of papules and sometimes cysts associated. So in terms of treatment, it can be beneficial to treat it the same way as we treat acne. The types of acne, if we categorize it by mild, moderate, severe, and scarring, can be treated with different options. First of all, topical treatments can be used pretty much in all kinds of acne, including severe acne. And topical treatments can range from benzoyl peroxides, topical antibiotics like clindamycin, erythromycin, retinoids like retinate, differin, Tazorac. But my favorite go-to topical acne treatment at the moment is Exone, which is topical Depsone. It's an anti-inflammatory and it targets the inflammation, which is the basis of acne. I very much think that blue light devices are helpful in acne because they target the P. acnes in the skin, and so incorporating blue light into the treatment is always helpful. Glycolic acid pills, microdermabrasions can all be helpful in mild acne and even moderate acne. But once acne gets more beyond the mild stage and more moderate and or severe, you want to consider using more extensive therapies such as lasers and the device that I like to talk to you more about later on today is radiofrequency. I use the pulsar laser for moderate acne. I use it also for severe acne. But since I started working with the Fractora device, which is a radiofrequency device, it became my go-to treatment for moderate and especially severe acne, and especially acne that involves scarring. Now, scarring acne does not benefit from topical treatments that inflammatory acne benefits from. The only topical that I do recommend for scarring acne with or without treatment with laser is vitamin C, because vitamin C is needed for collagen production, and so incorporating it into laser treatments and even without laser treatment is helpful. There is the option of using oral antibiotics and Accutane for moderate and or severe acne, but you have to be careful because people on Accutane become sensitive to light, and also the skin doesn't heal normally under the influence of Accutane. So lasers and Accutane are not recommended to be used at the same time. Usually one wants to wait about 6 to 12 months after finishing Accutane to consider doing lasers. And so basically oral antibiotics are not my favorites. I don't like short-term options that don't last once the treatment is over, but I offer it to patients who don't know exactly what way they want to treat the acne with a more final kind of treatment. So let me talk to you a little bit about the Fractora, which is a very interesting new device. And what it is, it's a very versatile platform using radio frequency, bipolar radio frequency, and it allows the user to either do very minimal and superficial and easygoing treatments to actually performing really deep ablation. The treatment causes subnecrotic heating in the dermis, and we also find that blood vessels get coagulated. So we can use the Fractora for anything from resurfacing of fine wrinkles, scars, deep and or superficial, to rejuvenation, including tightening, pigmentation, and also vascular lesions. It's not only that the face that the Fractora is useful, it can also be used on the hands, it can also be used on the décolleté and the chest, on the thighs, and recently there are good results with treatments of stretch marks with the Fractora. The downtime with Fractora is minimal, basically within 24 hours, a little bit of redness and swelling can show up, which goes away quickly. There are no adverse events, and so this is a very versatile and useful device. And of course, there is more development coming our way, and I think there are more handpieces coming out. And so with that, we're going to have even more options to treat different conditions in different ways. So the Fractora is basically using radio frequency. It has on the two sides the negative electrodes which we call here electrode bars, and these are the negative ones, and in the center it has pins, and those are the positive electrodes. And the electricity basically flows from the center to the two sides. And if you look at it, you can see that you can get different depths of the flow of the electricity or of the radio frequency. So you get from the outer pins to the negative bar to the more medial pins. And so therefore, the larger the distance, the larger the depth, or the deeper the depth that the electricity and heat penetrate. However, because it's bipolar, we know what is the maximum depth it can penetrate. There are no surprises. You cannot go deeper than a certain amount determined by the placement of the pins and the electrodes on the sides. And so it's a very safe device. You don't have to worry about using it in the eye area or the neck area, where monopolar devices cause problems like lipoatrophy and some other things. So this is just a picture of the different pins that one can use with the device. And there are the 60 pins, which we use for mild and moderate surface scarring, wrinkles, and other conditions. And even more superficial option is the 126 pins. My go-to tip at this point is the 24-pin tip, which comes in two different versions. It comes in a regular 24-pin version. It penetrates about 3 millimeters into the skin, and after its penetration, radio frequency goes down all the way to the depth of those little pins. But the genius difference in this tip is that in order to protect the skin from being heated on the top and therefore preventing pigmentation, there is a coated tip. And the coated tips have no radio frequency touching the skin on the top. So they are coated with a silicone coating about 2/3 down, and so it's only the tips that go into the depth of the skin that actually transfer heat and radio frequency. So the result of this is that it's safe for acneic skin. We can use it for type 4, type 5, and I even use it right now on someone who is an actual type 6 dark skin patient. And we see a lot of improvement in acne scarring, and there is no problem with post-inflammatory hyperpigmentation at all. And this is very different from other devices that we have used in the past for acne and or scarring, such as the CO2 laser, which causes thermal necrosis. And with the CO2 lasers, we don't really know exactly how deep the penetration of the heat, the thermal necrosis zone, is going to be beyond how deep the laser itself can shine the CO2 into the skin. So the Fractora with the coated tips is basically sparing the epidermis, and the heat is not going to be causing any pigmentation on top, and the depth of the penetration of the radio frequency is determined by the depth of the pins. And since it's bipolar, we know that there's not going to be any radio frequency going deeper or further than we expect. So it makes it very safe. Of course, it's very effective for acne scarring and some other surface problems. There is a study on the use of Fractora on acne skin by Dr. An and Dr. Mulholland. And basically, they took both Caucasian and Asian patients, and they used the 60-pin tip. And the most important outcome of this study is that they have found absolutely no post-inflammatory hyperpigmentation or hypopigmentation after the treatment. So this makes this device very different from most. My own experience with the Fractora is it started out as a learning curve. I started using very conservative and careful energy levels, and I still do. When I start treatments, I generally start a little bit lower, and currently I use settings of maybe 30 millijoule per pin with the 24-pin tips. And then each treatment I try to go up another 5 millijoules, and then next treatment another 5 millijoules. And so I have recently treated as high as 50 millijoules per pin with the 24 pin tip in both kind of type 1, 2, and even darker skin types. So once somebody uses the device for a while, you can get a sense of how you can push the energy levels and see what the skin tolerates and see what the patients can tolerate. I use it, of course, for acne, including cystic acne, and it does really great. I think the reason is because it basically eliminates the sebaceous glands, and it helps shut down the vascular supply to those acne lesions that need vascular supply to bring nutrition and oxygen to the spots. And not only that, but I use it a lot for wrinkles. The 24 coated tip is wonderful for tightening the skin on the neck, for example. And so it's a versatile device used for scarring, for actual inflammatory lesions, for texture abnormalities, and very safe in acne skin. Now that I have had about close to a year of day in and day out experience with a lot of patients, I started stacking the pulses, especially with the coated 24 pin tips. This is a good thing to do because once tips are already in the skin, the energy is delivered deep and it spares the epidermis and it doesn't cause any extra pain. I tend to do at least 2 passes. If somebody has very sensitive skin, I do 1 full pass, and then I go back to the areas where I have some active lesions or scarring, and I do a second pass. But I actually have gone over some areas even 3 times in patients that need it and that can tolerate it. In order to determine how the fractura between the pins and the heat can induce collagen production and improve scars, we had one of our patients agreed to take biopsies before and after the treatments, and I have just received the results of these biopsies. And it's simply amazing that the depth of the scars in the biopsy before the treatment was 1.5 millimeters. And after 4 treatments with the 24 pin tip and 3 months after the last treatment, the post biopsy showed that the depth of the scars was only 0.8 millimeters. So it's almost 50% less than the original scar depth. I think this is highly significant and gives us a lot of options in treatments of not only acne scars but chickenpox scars, and I think any kind of scarrings from keloids to stria to other kind of lesions. So in terms of patient experience, I would like to share with you a testimonial about the experience of one of my patients, a young lady who had very bad acne. She came to me very depressed, and she has just completed 4 treatments with the Fractora. I think the testimonial will basically speak for itself. She had no self-esteem, and now that her acne is so much better and pretty much no longer breaking out, and her scarring has improved significantly, she feels like a different person. So for this reason, I think treating acne, whether it's with lasers or other modalities, is very important, because it can give a person a different experience of their own self and their life. I have another patient, and this is another testimonial, and it talks a little bit about how the acne went from being very, very severe, cystic, and scarring to basically no acne at all. This is the patient who had the biopsy showing the almost 50% decrease in the depth of scarring. So for a young man, who is 21 years of age, this is a very big difference. He talks a little bit about how it felt, and I think it's more an annoyance to him than something that involves pain, and he thinks that the recovery wasn't bad. So this is something that we can pass on to the patients when they come in and during the consultation. Um, so this is kind of representative of how other patients respond to the treatment. Um, Let me talk a little bit about how I do the treatments. I think it's important to offer people topical numbing. I use EMLA, but there are other ways of using topicals. Some people do blocks. I don't usually do blocks. I just use topical EMLA. And I use air cooling. I have a Zimmer cooler, and I think it's very important. It makes the treatment less unpleasant during the treatment. And it also helps take out the heat from the skin after the treatment is over. So generally we do about 15 minutes of post-treatment cooling, and then we apply some plain Aquaphor and have the patients use it for about 3 days after the treatment, and that's basically all the aftercare that they need. If somebody is very sensitive and doesn't like any pain at all, if someone comes and picks them up, we can offer them Vicodin and or Valium and or the combination. And most people don't need it, but if they do, it's something that can be considered. The downtime after the treatment is really not very extensive. Usually the first 3 days you see little spots, like brown spots on the skin, which corresponds to the pins, and by day 4 or 5 it's pretty much dried up and starts sloughing off. And after the first 3 days we consider the skin healed. So using makeup and foundation is perfectly fine, and so people can actually go out and live their lives by day 4 as always, totally normally. So I just like to tell you again that in my opinion, treatment of acne, especially with the Fructora, is life-changing. It improves patient self-esteem, and they basically go out and they pursue social and professional activities like a different person, someone with self-confidence. I like to show you some before and after photos because a picture speaks 1,000 words. And this is a photo from Dr. On showing the improvement of scarring um, in Asian skin, type 4 skin. And this was with the 60 pin tip. And she went all the way from 30 millijoule per pin up to 45 millijoule per pin. And this photo was taken 3 months after the last treatment. As you can see, the skin is much smoother in the after picture than before picture. This patient is my patient. This is the patient who had the biopsy, and you can see the cystic and pustular acne with the scars on his forehead and on his cheeks, especially in the temple area. And the left side shows before, the right side shows like a different person basically after 4 treatments. This was a person that we treated from 30 millijoules in the beginning, but on his last and 4th treatment we got up to 50 millijoule per pin, and he was happy, and he said, you can do it stronger if you like, you can do it stronger. So you don't have to go stronger, but you can go pretty high with the energy levels on the RF. This is another patient of mine, a very lovely actress. And not only that her acne and acne scars disappeared, but if you look at the little white arrow, she had a chickenpox scar that I have not really paid much attention to before the treatment. And it's only after the treatments were over that she said, you know, even my chickenpox scar is gone. And so you can see we basically marked where it used to be in the after photo. And as you can see, basically a little pigmentation is all that remained. She was also treated with the 24 pin, and we started with 30 millijoule and got it up to 50 millijoule per pin by the 4th treatment. This is her other cheek, and this just shows what kind of a huge difference it makes to have all those acne cysts gone. This is a patient, a Hispanic lady. She has type 4 skin. She had a lot of scars, and she had both scarring and pustular acne on her cheeks, especially the left cheek, and you can see her before and after here with a very big improvement. She was treated with the coated tips, And I like the coated tips. I feel like they're very safe. I started out with double stacking, but after realizing that the skin can really take it without pigmentation, I actually can get it up in certain areas to triple stacking. I only do that in the areas where there's more scarring or more acne. So on the edges where I don't need to go aggressively, I kind of feather it very lightly. But in the areas that are affected, I don't spare the neither the machine nor the patient. And this is just a close-up of her left cheek, showing the before and after, and not only that the acne is gone, but the skin looks so significantly smoother that I think it speaks for itself. Last but not least, I'd like to show you one more patient of mine. This is a young man who had terrible cystic, inflammatory cystic acne. He started out a few years ago with the pulsed dye laser, only completed 2 treatments, disappeared from sight, and came back a few years later, recently, with horrible cystic, scarring, inflammatory acne. So this is this patient before and after 4 treatments, and I want to show you a close-up of his cheeks. And you can see in the before picture on the left that it's really nasty, aggressive, extensive, very noticeable kind of acne. And for, he's in college, it really ruined his life. In the after treatment, you can see what a great improvement it is in the acne. And I personally feel that even though we are pursuing a protocol of 4 treatments at present, I would probably advise him, and I will advise him, to have maybe 1 or 2 more treatments, because in my personal opinion, as long as there is any erythema that remains, it means that the acne can flare up again, and I like to see it kind of gone completely before I consider the treatment finished. And of course, those extra treatments will further improve his scars. And this is the other side, and again you can see not only the acne that is gone, but even his scars are looking much smoother, much less red, much less inflamed. But I think he would benefit from those extra 1 or 2 treatments. So most patients do very well with 4 treatments. Somebody with this type of acne, with 2 more extra treatments, I think would be perfectly treated, no more acne, and the scars will look probably as smooth as can be. And on that note, I'd like to thank you for your attention, and I hope that you enjoy using Fructora.